NHS dentists on yesterday's programme, we have been inundated with your own horror stories.
And they really are, aren't they? Britain's Dental Association has told this programme that swathes of the country are, in fact, dental deserts, with demand far outstripping availability as the number of NHS dentists in England falls to its lowest level in a decade. Well, the Korby family in Bournemouth know only too well the pain that the crisis has caused. Granny Angie, Mum Alex and the children Teresa and Gabriel are all suffering from dental problems and are desperate to be seen. Morning to you all. Thank you for joining us. Obviously, not the circumstances in which we'd love to be talking to you, but it is what the story we're covering today. Alex, if we can start with you, just talk us through the impact that the lack of dental treatment and attention is having on all four of you in your family.
Well, there's 5 of us in the family. None of us are able to get a dentist appointment if we need one. My oldest boy was threatening to cut his own, rip his own tooth out due to the amount of pain that he was in. An emergency dentist did take the tooth out. My daughter suffers with a hole in her tooth and is just constantly given antibiotics, which doesn't solve the problem. And my younger 2 children have never been able to see a dentist because there are no dentists available.
And you yourself have got your own problems, haven't you?
Yes, I have my own problems. I have a couple of broken teeth. And to be honest, I've just learnt to live with the pain because getting a dentist appointment is impossible in the area.
And can we just... Teresa, your daughter, is there. Morning to you, Teresa. I mean, just give us an insight into what impact not being able to get to an NHS dentist is having on you. I mean, sleepless nights, days off school, I'm told.
Many sleepless nights. I would always be dosed up. So school, I was more sluggish from lack of sleep, and I would miss important lessons just to find a dentist appointment.
And what's the problem with your teeth at the moment? I know your mum touched on it there.
It's a massive hole in a cracked tooth, which led to an infection, which was the only thing they managed to solve.
That's awful.
It is just shocking. You're sitting next to Granny Angie, who's in the middle of the sofa. Angie, thank you for joining us this morning. You've got a lovely smile, but, of course, it belays the pain and the frustration that you're all feeling because you're not seeing a dentist. How long has it been since you've had any dental attention?
I've actually found a new dentist now, but I had 3 years without any dental help. I did have a dentist, but during the pandemic, they cancelled 4 appointments. And when I finally got through after the pandemic, they told me that I'd been deregistered because I'd failed to attend.
Oh, my goodness.
But thankfully now I have been able to find a dentist.
You had, like, loose teeth, didn't you? I mean, it just affects what you can eat and everything, doesn't it? In fact, I mean, your whole day is dominated, presumably, by these blooming teeth that should have been sorted out by an NHS dentist years ago.
It was, and when I finally found the dentist, they actually had to take every tooth out of the top of my mouth, and I've had to have a full new denture, which I then had to pay £800 for, so somebody had to lend me the money.
Oh, my goodness me. So then you're taking out a loan to try and cover the cost?
Well, that's it. I mean, that is the cost on the NHS. And the question, of course, is that could you have gone private? Alex, I mean, it's an obvious answer, I guess, but we'll talk to Gabriel in a minute. The alternative, of course, is going private, and lots of people are saying, listen, when we go to the dentist, they go, we haven't got an NHS dentist, but if you pay 160 quid, you can come in tomorrow, you know. And have you had to consider whether you can even think about affording it for your kids, even?
As a low-income family, there's absolutely no way that I would ever be able to afford to go to a private dentist. There's 5 people in the house, so it's £160 each person. It's just not something that I can ever contemplate affording.
And Gabriel, what about you then? We've heard from your sister and your granny, and Mum's told us. What sort of impact is your dental issues having on you and your confidence at school and your school life?
I was born with 2 of my front teeth fused together, so one that fell out, only one of them actually grew back, and I have a large gap between 2 of my teeth, and I just generally don't like to show my smile, to have a proper smile to anyone, really, because I just don't like it at all. because of the large hole.
I mean, it's tough enough going through your teenage years as it is without being self-conscious about your teeth that you can't get sorted because you can't get any NHS dental treatment.
I'm sure you could hear what Dr Amir was saying about the long-term impacts of not getting teeth and gum disease sorted by a dentist. Mum, Alex, can I just ask you, you know, what are your worries for Teresa and Gabriel in particular? Because I know as a mum, you know, your first instinct is to fix it, is to solve it, is to get in there and make... You know, if they're in pain, your instinct is to take that pain away, but you can't do anything about it. What are your worries long-term if they don't get seen soon?
Well, long-term, it's a confidence thing. I mean, I wouldn't want them to go through life not being able to be themselves and being confident in how they look and how they feel. Then there's also the impact on the pain and as they get older, their work and thing, if they're going to have to miss work due to poor dental hygiene.
Yeah, and Teresa, can I just ask you...
So it's going to impact their whole life.
Yeah, and Teresa, can I just ask you, we asked Gabriel about what impact it's having on his confidence. You've spoken about, obviously, missing school days and being sluggish. What are you worried about? I mean, how's your confidence at school?
My confidence was all right for the most of it because I wasn't bothered by how people saw it. I was in pain more than anything. And the only bit I'm worried about is my grades probably would have suffered from the pain.
Well, understand that, goodness me. Well, look, we do appreciate you all joining us this morning and sharing your stories. Yes. It's reflected around the country and the viewers that will get in touch with us as well.
Can I just quickly ask Angie, just before we go, I know you said you found an NHS dentist now, haven't you? Did they say that they only had space for you, or could you register the whole family? Because I know I had a call recently saying we can register you and your family, which was a relief to me.
No, they didn't even give me the option of that. They just rang and said that we've had you on our waiting list. We've got a cancellation. Can you come tomorrow? And that's all that was said.
Well, thank goodness you could get in there, even though it did cost you some money, but you were able to sort the teeth out. We do appreciate you joining us and sharing your stories this morning. I mean, Dr Amir, what's your advice? I don't know what...
Yeah, what was your advice to this family, if anything?
Yeah, it's really hard. I hear these stories and my heart goes out to them and people are in pain, they're suffering and it's having an effect on their lives. I don't have any advice, really, apart from to the government, which is to sort out the contract with the dentist so patients are not suffering.
For clarity, should we just do this bit?
Well, a spokesman for the Health Department said they are working to improve access to NHS dental care by investing more than £3 billion a year in dentistry, as well as taking preventative measures to improve children's oral health. The £3 billion is you're grimacing, Amir, because it's not the money going to the right place.
I can't see it. I can't see it right now. Maybe in the future, but I can't see it right now.